The most common cause of liver disease in the United States is from hepatitis C virus. It accounts for probably 40 to 50% of most transplant centers' list of patients who need a transplant. It's a disease process that takes 20 to 25 years to develop scarring or cirrhosis of the liver, and there's no cure for hepatitis C. Transplantation helps overcome the cirrhosis and give somebody a new liver to function with, but again, the hepatitis C virus isn't cured, and it can come back to the new liver graft. The thing that I have found most frightening for patients that have liver disease, especially with hepatitis C virus, is the virus itself can also cause liver cancers. And if liver cancers develop and they get to a point where they're too big or too numerous for transplantation, all of a sudden now those patients can't get a transplant and won't live live a life that they want to live.
The symptoms that exist with primary liver cancer, or HCC, or hepatocellular carcinoma, again, usually they are discovered as part of a screening evaluation, so asymptomatic, outside of the symptoms that they would have associated with their cirrhosis. If they do have symptoms, it is usually pain, which is a bad prognostic finding. Patients with pain from their liver cancer don't do as well long term as if they did not have symptoms related to their cancer. The most common concern for someone with a diagnosis of liver cancer is whether or not their cancer can be cured. Every other concern takes a back seat to this, but these other concerns would include what are the side effects of the treatment, what are the costs of the treatment, and will my insurance company pay for it? And even if you can't cure the cancer, can you prolong or can you delay its growth and prolong my survival? There are multiple different options that need to be considered anytime you see someone with liver cancer. Some of these include surgery, some of these include surgery and other modalities, some include other modalities only and not surgery. Depending on a patient's situation, the best treatment may or may not include, and frequently actually does include, multiple different treatment specialists. As cumbersome as this may sound from the patient's perspective, because they have to see more than one physician and come to more than one appointment, it really provides them with the best chance of being cured. A lot of patients come wanting to know what can be done to save as much of their healthy liver as possible. Unfortunately, with primary liver cancer or hepatocellular carcinoma, it almost always arises in the setting of cirrhosis, so in patients without healthy livers at all. The best treatment option in this population is a transplant, actually, where we take out the entire unhealthy liver along with the cancer and replace it with a normal healthy liver. In the circumstance where someone has HCC or hepatocellular carcinoma without cirrhosis, surgery is the only curative option. This surgery is indicated only in those patients where the cancer has not spread beyond the liver, and also in those patients where enough normal liver can be spared or left so that they can recover. There are techniques called segment-oriented resections, or based on the anatomy of the liver, that are done for just this reason, to spare as much of the healthy liver as possible to give them the best chance of having a smooth recovery.